Good afternoon, Madam Shark. I'm Nash and I'm a medical student. I'm here to do a physical examination of your abdomen, and if you're okay to go with it, we shall proceed on. And in order to do this physical examination of the abdomen, you have to ensure that you have a chaperone with you. And for this examination, I made certain that there is a chaperone. We're going in with that assumption. You have to also make sure there's adequate lighting of the examination area as well. And to make sure the curtains are closed to give the patient appropriate privacy during the examination. And before any clinical examination, you have to make sure that you wash your hands well with any alcohol rub that's within the vicinity as well. And after which, I'm going to stand at the edge of the bed and I'm going to take a good look at Madam Shaw to see if she's in any form of distress, if she's appearing sick, or if she's appearing to be in any form of pain, or if she is breathless, and I will take note of her respiratory rate as well. Now, I'm going to assess her vital signs in general examination. That's where we're going to start off first with. We're going to assess the radial pulse, the character, the volume, and also we're going to ascertain the rate of the pulse as well. After which, I will take her blood pressure using a traditional sphygmatometer, or you can use an electrical blood pressure monitor as well. So you're going to assess for any form of anemia, general health of the patient as well. So do not forget that you have to take the body mass index of the patient. You can either take it during the examination or before the examination. This includes the weight and the height of the patient as well. So after that, you're going to check for pallor of the nails of both hands, and you're going to check for capillary refilling time, whether it's less than 2 seconds. After which you're going to examine the face. On face examination of the face, you're going to pull down the lower eyelid of both eyes gently, looking for conjunctival pallor or any signs of jaundice of the sclera as well. So you're going to ask the patient to open the mouth, hit the tongue at the palate to look for any cyanosis, signs of cyanosis at the region of the tongue or under the tongue, and also around the lips. So this may appear as a bluish discolorization, and also the general hygiene of the mouth and the oral cavity as well. Before we proceed further, we are going to assess the neck as well to see if there's any generalized swelling of the neck. We are going to examine for the patient's leg, and for that we're going to expose the leg to an adequate amount, and you're going to look for the things that we have seen in the hand as well, such as you're going to look for pallor of the nails, the capillary refilling time, and most importantly, you're going to look for edema of the legs. So edema of the legs, how do you look for it? You're going to look for the bony component starting from the most distal end of the limb. So that would be starting from the first bony component of the first metatarsal bone, and you ascend upwards by pressing on it and by pressing on the suspected area with your thumb and holding onto it for a short while, and taking your thumb off and feel for an induration of the skin. So that concludes the general examination of Madam Shark, and now we are going to we just concluded general examination of Madam Shark. Now we're going to proceed on with abdominal examination. For abdominal examination, we're going to ensure that there is adequate exposure of the abdomen for this to take place. And for that, with Madam Shark's permission, you're going to allow exposure. Ideally, you would want to expose from the breast until the pubic symphysis, but in our clinical setting and learning, we usually expose from the xiphisternum until the pubic symphysis. So here you go. So now Madam Shark is exposed. So we're going to stay at the edge of the bag once again, and we are going to assess all 4 quadrants of the abdomen to see whether they are symmetrical, to see whether the umbilicus is centrally placed, whether it's inverted or whether it is everted. You're going to identify whether all quadrants of the abdomen are raising equally with respiration, and you're also going to look for any signs of skin discolorization around the flanks or around the periumbilical region. You're going to also look for any obvious signs of swelling or any masses that could be seen, or any visible pulsations of the abdomen as well. So furthermore, you're also going to assess for any surgical scars. You're going to assess well by checking the sides and the flanks of the patient carefully to ensure that there are no hidden surgical scars. And you're going to also lift of the abdomen and check around the pubic symphysis area to see if there's any surgical scars there as well. So that concludes the inspection of the patient, and now we are going to proceed on with superficial palpation. So before we proceed on to superficial palpation, according to Dr. Khan, we have mentioned that this patient is unfortunately coming with a mass. So on my inspection, I am able to notice that Madam Shark has a mass that is visible around the suprapubic region. And for that, now with that in mind, I'm going to proceed on with superficial palpation. For superficial palpation, you're going to maintain good eye contact with Madam Shark because you want to ensure that whether she is showing any signs of pain or discomfort as well. And furthermore, you're going to also ask Madam Shark whether she has any pain and to point it for me if she has, so that you can start your palpation away from the side of pain. So now we're going to proceed with superficial palpation of all 9 quadrants of the abdomen. So on superficial palpation, Madam Shark did not elicit any signs of tenderness. However, there was a mass felt in the suprapubic region of the abdomen. Now I'm going to proceed with deep palpation. For deep palpation, I will ask Madam Shark to take deep breaths in and out. During each inhalation, I will try to push down with my palpation on the abdomen. On deep palpation, I was not able to elicit any signs of pain or tenderness. However, I was able to appreciate that there was a suprapubic mass present in Madam. So now we're going to go and assess the mass that Madam Shark has. So in order to assess the mass, we want to identify the site of the mass. So the site of the mass is in the suprapubic region. Now we are going to identify at which gestation level the mass is present. So you have to also make sure that before you start any examination, especially in gynecological examination, you have to have the tape measure priorly ready so that you can take the measurement at hand. So you're going to start Ziffy sternum, palpate along until you hit the upper border of the mass. In this case, it's suprapubic mass, and if it's below the umbilicus level, it is likely that this mass could be present at less than 20 weeks of gestation. So you're going to hold it straight there, and you're going to take the measurement of the mass dimension vertically, vertical measurement of the dimension. Now after that, you're going to assess further dimensions of the mass. You're going to palpate around looking for the borders of the mass. So once you have identified the surrounding border of the mass, you're going to take further dimensions and note it down. Afterwards, you're going to assess for the surface of the mass, whether you're going to assess for tenderness or temperature, and you're also going to assess the overlying skin of the mass as well. And furthermore, you're going to look for, you're going to palpate for the consistency of the mass, whether it's soft, hard or firm. You're going to also look for the surface of the mass. Is it nodular or is it smooth as well? Lastly, you're going to see whether you can get below the mass. So this is to identify whether the mass is originating from the pelvic region. So in order to do that, you have to palpate for the lower border of the mass, and if you can't go below the you can palpate or feel for the lower of the mass below the pubic symphysis, that means it is likely that this mass could be originating from the pelvic region. Further next, you're going to look for the mobility of the mass. So you're going to see if the mass is mobile vertically. If the mass is not mobile vertically, then it is likely again that this mass could be originating from the pelvic region as well. Now you're going to look for the further mobility of the mass as well. So that concludes the examination of the mass. I'm going to proceed on and complete what's left of deep palpation of Madam Shark. So you're going to again palpate deep palpation of the liver, starting from the right iliac fossa. And now you're going to start again from the right iliac fossa, go diagonally to look for the spleen. Madam Shark, could you please turn over to the right side? Gonna wait for a short while. Palpate. Going to also percuss for the throat space while you're at it. Okay, now I'm going to do ballotment of the kidneys before we head for percussion, after which I'm going to start percussion now of all 9 quadrants. So on percussion, all 9 quadrants, you have to elicit whether they were tender or not, and if any masses were present, they will appear dull on percussion as well. The rest may appear tympanic. So now I'm going to percuss for the liver span, Starting from the right iliac fossa and upwards for the lower border of the liver. And from the upper border of the liver, you want to start from second intercostal space and go below. And you want to take your tape measure and mark the liver span as well. Next, you're going to look for ascites, and that is done by shifting downwards. Once you hit the downwards, you're going to ask Madam Shark to turn over to the right side, wait for a short while, and you're going to focus again to see if there's any downwards elicited. Then you're going to do a fluid trill. Fluid trill, I'm going to ask Madam Shark or my chaperone to place their hand over the midline of the abdomen, press firmly and gently downwards, like that. And while I assess for a fluid trill. I want to complete my abdominal examination by auscultation for bruits as well as bowel sounds. So for bowel sounds, I'm going to look for the quality of the sound heard at which interval, and by timing it for 1 whole minute at the right and left iliac fossas respectively. And the periumbilical region for renal bruits as well. Thank Madam Shark for helping me with this examination, for her cooperation. Furthermore, I would also like to tell her that I can complete a complete gynecological examination with breast examination, pelvic examination, as well as a rectal examination as well. So thank you, Madam Shark, and thank you everyone for listening.